All new here tonight, it is a focus team investigation on nursing homes in our area that's been months in the making. We all know they've had a tough time during the pandemic, but that's why the federal government stepped up to help. However, as our John Charlton found out, at the same time many nursing homes were facing hefty fines, some of them were also benefiting from government rewards.
When it comes to inspection reports, some can be very long reads. Take this one, just one report on one of Louisville's nursing homes.
Hundreds of pages.
338 pages on Regis Woods from last May. A novel detailing serious issues at the facility, including residents fighting resulting in broken bones. In one case, one resident hitting another with a television. Sexually inappropriate behavior by at least one resident with another who was incapable of giving consent, and slow response times to residents' needs.
You turn your call light on and maybe they answer it, and if they do, it'll take 30, 40 minutes.
Things got so bad at the nursing home that 66-year-old Robert Catron
Nobody checks on you at nighttime.
was one of the last residents left at Regis Woods
At nighttime, I don't feel safe at all.
as it was preparing to shut down for good.
That's one of the reasons they're in trouble. They're short of staff.
Medicare and Medicaid are being cut off.
Doesn't that tell you it was really bad here?
Well, it certainly does.
And Jackie Walden has to relocate her 99-year-old mother.
It shows that some of our concerns were justified.
Before it came to this, Focus was already digging into the problems at not only Regis Woods, but also at other struggling Louisville nursing homes. The highest fined ones in 2020 were Highlands Nursing and Rehabilitation for almost $325,000, St. Matthew's Care and Rehab for close to $181,000, and Hill Creek Rehab and Care for just under $66,000. Meanwhile, Regis Woods got slapped with around $202,000 in fines.
We are the most regulated healthcare sector.
Betsy Johnson is the president of the Kentucky Association of Healthcare Facilities.
We're taking care of a very vulnerable population.
And the Kentucky Center for Assisted Living.
Unfortunately, the way our government regulates skilled nursing facilities is a very punitive system.
But in 2020, the government also rewarded nursing homes through CARES Act money, as well as through the U.S. Department of Health and Human Services and its nearly $2 billion Provider Relief Fund COVID-19 Nursing Home Quality Incentive Program.
You have to have money to keep the lights on. You have to have money to pay your workforce. You have to have money to acquire PPE. That's what the Provider Relief Fund was intended to do.
I like to call them the bonus payments.
Brian Lee advocates for residents in long-term care facilities as executive director of Families for Better Care. Lee argues the quality incentive payments rewarded failing facilities.
They're a handout to the nursing homes.
And those payments in some cases far exceeded the fines the nursing homes were facing.
It's appalling. It's absolutely appalling.
According to the Quality Incentive Program spreadsheet, a total of $33,786,224 in payments went to Kentucky nursing homes, and 17 of the 29 fined in the Louisville area got help. The highest fined, Highlands Nursing and Rehabilitation, didn't get a cent. However, two payments to St. Matthew's Care and Rehab totaled $206,145. Compare that with their fines, the nursing home more than broke even with more than $25,000 left over. Regis Woods did even better, a whole lot better, rewarded with $568,440 in payments, which is 181% more than the fines it faced. Regis Woods, part of Genesis, the largest nursing home operator in America, yet the facility is closing.
If they had the wherewithal to absorb some of the cost of the pandemic, I think this would be the company that would probably do it.
We support any type of reimbursement or any type incentives.
While the Centers for Medicare and Medicaid Services was fining, its own department, the U.S. Department of Health and Human Services, was rewarding.
Where's the accountability?
Well, that's an application process. I think we'd all admit that sometimes the government doesn't always make sense of the way they implement things.
You're getting all these fines, yet you're getting rewarded on another end, and that just wipes away the fine. Not only wipes away the fine, but also adds more money to your bank.
And I don't think they're the same thing. They're completely different things.
Some people say they're comparing this apples to oranges. I don't think so. We're talking about fruit at the end of the day.
Brian Lee complains it was low-hanging fruit, branching off from the pandemic relief nursing homes were already getting.
A carrot out there that the feds dangled before the nursing homes to get them to submit their COVID data.
Not fruitful enough, however, to keep this nursing home open.
Here the last month, sir, it's been awful.
Now, nursing homes can file for grants for improvement projects from the civil money penalties, which are the fines. The Commonwealth of Kentucky says right now there is close to $39 million in those funds. To review inspection reports, the fines levied against nursing homes, as well as the quality incentive payments made to nursing homes, go to WHAS11.com. We've posted links on our website. John Charlton, WHAS 11, on your side.